You've both been involved in the AOD space for many a year. And it's, as Michael said, it's a challenging field to be in. So what has kept you engaged in the field? Why have you been involved for so long?
Nowhere else would have me. Well, it was a passion for personal reasons, and I thank Michael for taking 20 years off me. I actually started as a peer worker for the reasons that many people start as peer workers in 1972. And so for me, it's always been a passion. But I mean, what's kept me in it for so long? I love the people I work with. I love the variety in the job. I don't think there's any other job would give me the opportunity to contribute to policy, to be involved in history, to work with people affected by drug use, to meet the wonderful people who represent the communities that we serve, the people like Paul Dessert, who really invigorate you. But the absolute variety and the wonderful people that I work with, and most of the people that I've met in this field are in it because they want to make a difference. And that has enthused me. And I wouldn't have taken any other career path. So it's just been wonderful to work with. And the people in it have been wonderful to work with. Thank you.
What about you, Mike?
Well, I'm not sure I ever planned to be in this career. My career is a lot of happenstance. So I did quite a lot of medicine. I decided I didn't want to continue in medicine, so I decided to translate into psychiatry. And I was going to do neuropsychiatry. I had no interest whatsoever. When I go back to my very early medical days in Dublin, where we were watching people dying of heroin, we were watching the whole heroin epidemic thing, and I, at that point, had no notion that I'd have anything to do with this. And then I met Griffith Edwards, and but not just met Griffith. I also worked in an alcohol clinic, and despite all the negativity around, oh, you don't, this was where I saw some of the greatest impact of treatment in reality. And I was also in the context of being trained in research, pretty generically trained, but actually also being inspired to see, a bit like what you've said, Steve, about how you could go across from basic science to culture, to politics, to economics, and the breadth of things involved. And as John Strang would say, I started dabbling. And after a while, I was more than dabbling. And then it became a full-on addiction. And in terms of keeping it up, I think having the opportunity to be doing clinical work, to be doing policy work, to be doing research, it paces you over a long period of time because you can do different things. And actually, you can also see the impact and the importance of the impact.
Were there any seminal moments or events that were sort of really transformative in your career?
I can tell one, and it wasn't transformative other than to make me think, am I being clear? I was running a 1-week workshop up in Darwin, and a guy came in about 5 minutes late. And after 2.5 hours, we took a break for coffee, and he put his hand up and he said, "This isn't about cattle, is it?" And I thought, 2.5 hours, what have I been saying? So that transformed me to be a bit clearer. I can't think of any similar influence. So I met Griffith, and I mean, he's been an influence on me, on Mike, on Paul. And I think when I met Griffith, and when it was the British Journal of Addiction, and I became the Scottish rep, and I was very young. I think I would have been about 28, and I'm the Scottish representative for the Society for the Study of Addiction, and met Griffith, and that made me determined for me that this is the field I want to work in.
Mm-hmm.
And there's many influential people I've met, and we may mention some of them later on, but Griffith really enthused me and inspired me. So that would have been a transformative moment, I think.
I wouldn't say transformative, but I would say that quite early on, I did a stint as the senior policy officer in the Department of Health. And it was very early into and I actually learned so much about the bigger picture in that context and how I could bring that back. So, and actually around that time, I also was asked to go to Geneva to chair this thing, which was the external evaluation of the Swiss heroin trial. And it was an incredible experience because it was 100% politics and about 5% science in relation to Americans and people for and against. And there was people like there's a lot of people like Jerry Jaffe, when I first met Wayne Hall, and that was a fantastic experience.
And did that influence how you thought about impacting on policy?
Well, you know, the whole thing about it is the whole commitment I think we've had is a commitment to evidence-based policy. I remember sending young Paul Griffiths off to the Pompidou group. When I was in this job in the Department of Health, I asked him to go. And when you went to these groups, the epidemiology they were presenting, and you thought, God love us, we're really in the boondocks here. And if you look at it from then to now, the changes in the evidence framework and the changes in how we look at the whole thing around alcohol and other drugs has been, it's actually been truly remarkable. And it's a credit to, I go back to this thing, it's a credit to everybody in the field, how the field has moved on and matured and become pretty tough and rigorous around evaluating things. It's not without its blind spots, as Michael would have said. You know.
Both of you have worked and lived outside of Australia, have immigrated to Australia to take on new roles. Looking back, can you recall any of your sort of first impressions of how the research and AOD landscape may have differed in Australia compared to the UK or to Europe?
My first, so I headed up the Alcohol Studies Centre in Scotland. And when I came out here, the budget I had for one aspect of work was 10 times the budget that I had for the whole of Scotland. This is a bigger place, but the population was considerably bigger. It was extraordinary to be gifted that. And it was also an incredible time because Bob Hawke had put a lot of money into this field. The then health minister crafted that to be much better than it could possibly have been. For example, making sure that alcohol was included. And it was David Hawke approached me and invited me to apply, and it was, and there was a couple of things. I was nearly an immigrant here when I was 14. And then I worked with a guy from Perth, a sociologist at Glasgow University for some time, who inspired me to think about going. And then the other thing was the weather. And David's probably forgotten this, but when he asked me, well, was I going to accept the job? I asked him what the temperature was. And it was in June, the middle of winter. And he said it was 23 degrees. I thought, it hasn't been 23 degrees here for 4 years. I'm coming. But yeah, I mean, the sheer, it was an exciting time because there was all this new money had come in, the opportunity to do what you wanted with a significant budget, and people were really hungry for it. It was an extraordinary time. I'd never seen such hunger to make a difference. There was all these new people coming into the field, and it was extraordinary. And I mean, it was like a kid with all the best toys that you could possibly hope for. All the things that I'd hoped to do which weren't going to be possible where I
Mhm.
lived. And then I think the incredible investment in research that happens here, the connection, a much closer connection with politicians, it varies by minister, but the ability to sit with ministers, and I mean, that just didn't happen in the UK unless you work for the alcohol industry. It just wasn't possible. And I know it's frustrating at times, but that ability to sit with politicians and sometimes to get politicians who wanted to make a difference and to see that happen was extraordinary. And I'm still inspired by that. It still makes me enthusiastic for this area.
Well, I first came here to a conference in 1992, the Harm Reduction Conference in Melbourne. And it was a very influential conference because at that time, we were all preoccupied with the outbreak of HIV, injecting drug use. And there was a fundamental paradigmatic shift happening where we were saying, actually, this isn't about stopping people using drugs. This is about making sure that people are using drugs in ways that they incur less harm to themselves. And the collaboration around the world around addressing this, and also the fact that people were dying in front of our eyes, and the urgency of the time, it was quite spectacular in actual fact. And the investment and the development around that time, and it was very much, but actually Australia at that time was really quite a leader in the field in the stuff. And we developed very strong collaboration. I didn't realize I was on the slippery slope to Australia at that stage. But we put out one of the first editorials, actually after that 92 meeting, the first editorial calling for the general distribution of naloxone. And that was, you know, I mean, it didn't take much to put an editorial out, but still it sort of was at the time regarded, and we did a lot of work across between the UK and here and that. And I, you know, people say it used to be much better than. I think people don't recognise the fact that the field in Australia has come to a degree of maturity where it can't be quite as radical as it would love to be in relation to keeping programmatic functions going in systems. The smoking programs, and I know at the moment smoking and vaping has become an incredibly contentious area with a lot of division in the field, which is sort of sad in a way, but probably generates some energy in the system.
Excellent. And that's a lovely segue into my next question is thinking about policy and reducing alcohol and other drug harm. What is sort of the biggest lesson that or learning that you can share with the audience?
Well, I was, because I did a sort of similar reflection at the end of the symposium last week in NDRI, so I can, and if you go back to the original summit and you go back to Baum's comments on it, the one of the critical things here, I think, was that while at the point in time when people were pushing the importance of injecting drug use, they also made sure to make it clear that there was more harm from alcohol and tobacco, and that that it all needed to be worked together. And I think Australia did better at this than a lot of places.
And an incredible debt to Neil Blewett for that.
Yeah. And that's, I think, keeping the focus, just because you've got an urgent problem doesn't mean you don't keep your eye on what are the big problems. And Steve will mention it again, that we have the problem of legal addictions, whether they're behavioral or substance related. And it's much harder to get the government off its revenue addiction.
What about you, Steve?
Repeat the question.
Key takeaways about how to impact alcohol and other drug harms.
Well, it's not something that I would. It's something that bothers me immensely. And I think it's the key challenge that we have in this field, and that's the stigma and discrimination that exists for people affected by drug use. And I include alcohol in that. The common models are about it being, they brought it on themselves, they're not deserving of help. Why should we help people like this? And that colours everything. It colours the willingness of people to have treatment services near their door. It colours the willingness of people to actually take these issues on politically. It colours the willingness to stand in front of, you know, the needle and syringe, the review of the needle and syringe programs, the impact that that had on our community, and the evidence about the effectiveness of that at preventing harm, preventing death, the overdose strategies. The evidence about that is really strong, really clear, billions of dollars saved just in terms of the economic stuff. And but it's just not something that the politicians are willing to stand in front of, because it's not a vote winner. They're not nice people. So I think it affects whether or not people see themselves at risk, whether or not they're receptive to prevention ethic, because I'm not like those people, so this isn't directed at me. It colours whether people are willing to put their hand up to seek help. It colours whether or not they get help and the sort of help they get. And it colours whether or not governments are willing to put resources into this and to support this area. So I think that is still one of the biggest challenges, and I recognise the work that lots of people have done. I think the other thing that's I've been strongly influenced by is the First Nations communities and the people who've influenced me: Anna, Michael Wright, Ted Wilkes, Scott Wilson, Wendy Casey. I learned so much as a newcomer, as an immigrant to these shores, about how that sort of community leadership and cultural connectedness and how all of that, Andrew Imora, who influenced me strongly, the sort of leadership that I got from those friends and colleagues influenced how I thought about how I worked in other communities. And I think we have an enormous amount to still learn from those people and other people who work in the First Nations domain.
Mike, I might ask you a slightly different question. Thank you, Steve, for that. But building from what Steve says, do you have any sort of tips for the audience about how to be more impactful and to influence policy, given the challenges around stigma and discrimination and political will?
Gosh, I wish I knew the answer for that one.
I know,
Look,
$1 million question.
We all want to be impactful. You know, if the impact we want is to improve the health of the population, and if we can do that, it's a huge achievement, but it's a big struggle. And you know, and I look at the stuff we've evaluated around the impact of opioid agonist treatment, and showing a very major reduction in mortality in relation to both general population and prison release. That's, you know, that in itself is a big impact. But if you look at alcohol and you see our impacts there, if you look at gambling, there's a whole range of areas where it is extraordinarily hard to shift the dial on this, and we are dealing with issues in the context of social equity, social responses, and I think we have to be modest about what we're at times, the forces we're up against, and how we handle it. So you know, yeah.
And if I can, I give two examples of what not to do.
That's
So
helpful
one
as
of
well.
the issues in our field is we don't sing from the same song sheet, and particularly on alcohol. And an illustration of that is when Minister Roxon brought in the controls on ready-to-drink alcohol, that removed a tax break that was on those. Wouldn't have been the first thing I would have done, but many of our colleagues said, "Oh, that's the terrible thing to do. I wouldn't do that." And some people were saying, well, I would do that. And some people were saying, oh, what's going to happen is people are going to start buying full strength alcohol. And there was this cacophony of noise that didn't support the minister taking a step in the right direction. And constantly in the field, we have strong opinions about what should and shouldn't happen. And we don't sing from the same song sheet. And if we want to make a difference in relation to alcohol, we have to sing from the same song sheet. And I think we can learn a lot from the tobacco area in health response. And if we can't get that right, then we're not going to get the minister's ear. We're not going to have an influence. The other thing is an illustration of myself, is be prepared to have, and I've learned this very much from Mike Daub. If somebody says, well, what do you think we should do, Mike? He's got one in the drawer that he pulls out. And I've told this story before, but it's not very congratulatory of me. So I found myself just after Rudd had been elected, sat at a table having lunch with Minister Roxon. And she looked at me and she said, so what do you think we should do about young people and alcohol, Steve? And I went, oh, we need to do some research to find out what the prevalence of it. And I just watched her eyes roll up and you know, have an answer ready. And I've certainly learned that from Mike. He's always got the, if it's not ready, if it's not now, it's ready for next time you get asked that question. So have the response for that rare moment, that rare opportunity. And don't be talking about what sample power you might need and analysis power you might need if to the minister when she asks, what should we do about this?
Anything you would like to add, Mark?
No, that's fine.
That's good. Yes, policy windows. Great. Now, moving on to, I think, taking out the crystal ball and looking into the future. From your perspectives, what do you think are the key challenges that may face the alcohol and other drugs sector in the next 5 years or in the future that we should be prepared for? Mark, can I start with you?
Well, they're manifold, but I think the big challenge at the moment is what I've already said, which is legal addictions, where gambling, etc., where there is very little leverage on us to influence government. But I think the bigger challenge, we've mentioned already stigma and discrimination. We've mentioned workforce issues. We've also, I think if we look at it in general, my feeling, there's two issues that I think I've been very struck by in Australia, is the relationship between the mental health sector and the alcohol and drug sector is pretty bad. And I don't see the way through that. I do see there's a problem. The fundamental problem is that there are two demanding sectors that are underfunded. And in that context, it creates issues around how you would get them to coordinate together. But I do see it as a political problem. I don't see it as a research problem. I see it as a problem about, in terms of the consumers, they do not need to be caught between professionals having resource allocation battles. They need to get seamless support. So I think that's a big challenge. And I think the other challenge will be resourcing. I think it remains a stigmatized and under-resourced sector. If it was cancer, if it was cardiovascular disease, we would have different answers now than we do. And the challenge of making the case for the importance of research, because one of the problems here at the moment is people tell me that they think there's too much research in Australia. I mean, it is just nonsense. And you cannot, we have failed to provide tools for people. We failed to provide the tools for people to be tackling complex problems. And we still haven't made much progress. And we need to make a lot more progress to enable people to tackle these complex social problems.
I guess, well, stigma and discrimination again, and then linked to that, moving into where primary healthcare actually sees alcohol and drugs as its day-to-day business. Most people affected by alcohol and drug issues wouldn't want to go to a specialist service. Specialist service probably isn't there. They see their GPs, they see their nurse in the hospital, they see, lots of people who could actually help. So, and the specialist services just couldn't deal with every issue that's out there in the community. So dealing with that, getting harm reduction is on the table, but don't even get a knife and a fork to go with it. Actually having harm reduction seen as a legitimate, a lot of people see it as illegitimate, or they say we do it, but really what they're talking about is nothing to do with harm reduction. And actually funding it, it is a pillar in our strategy, and yet it gets bugger all funding. So I think that has to change. And it's demonstrated time and time again that it has huge impact. Recognizing and celebrating the role of people affected by alcohol and drug use in the changes that have happened in our community, and actually drawing on that incredible expertise. And again, we've seen that time and time again. We've seen leadership from people like Robert Eli and Simon Lenton and Paul Dietz on overdose prevention, but it wouldn't have happened without the consumer groups. Wouldn't have happened without AVIL. Wouldn't have happened without your group, Paul. So really backing that in and making that sort of contribution of people affected by alcohol and drugs. And then the other issue, I think, of humanizing the area. We're not talking about addicts. We're talking about somebody's mum, somebody's daughter, somebody's friend, somebody's sister, and actually providing the same degree of dignity and care to people affected by alcohol and drug use as we would to anybody else. And this idea that they're not deserving, it's a bit like saying somebody crosses the road when the little red man's showing, or woman, or whatever it is. And you cross the road and you get run over, you don't say, well, it's your fault. You cross at the wrong time. It's your fault. You deal with it.
Actually, somebody might say that.
Yeah. Somebody might. Or somebody who cardiovascular problems because they've eaten too many pies. We help them. People have got a responsibility for what happens in their life, obviously, but they're not to blame for things. And this idea that people brought it on themselves is an absolute bloody nonsense. And to get to a point where we invest in the strategies that make a difference, where we celebrate the difference that is made by people affected by alcohol and drug use in our communities and in the work that we do, I think is really, really important.
And Steve, if there was one thing that you could see an investment in, what would be at the top of your investment list?
Well, same thing. Let's deal with the issue of stigma.
Okay.
Let's deal with that. A lot of other things will follow from that.
Okay. What about you?
I go back. I have a mantra which says if we spend 1% of what it costs, we could increase research tenfold. Now, I don't want research for research's sake. I want research for things that make a difference to communities and individuals and families. Okay. I'd actually love to see as well. I think the area we've gone back on is peer and peer workforce. And actually, I think the area we have never really made enough progress on is support for families and that. So,
And it's interesting that you say we've gone back on peer and peer workforce. I'd love to hear from your perspective over years how we've gone back on that.
But the reason I say that is because I think when I came here first, visiting, I thought that some of the movement around the peer workforce was much more organised. Okay. And it hasn't been supported in that way to be as organised. But I'm pretty optimistic that that's an area that it will grow in the future.
Okay. And I'm going to ask a question now that is maybe I'm a little bit, it's really about my area of interest, but Also, you have both been leaders of research centres and institutes and have a wealth of experience. So what tips do you have for, or recommendations based on your experience for really having and creating effective research collaborations and connections to have the impact that you hope research to have?
A good business manager. I wouldn't have come to NDRI if Fran hadn't been. I wouldn't. And because there was somebody like Fran there who kept things on track, and others who've come after Fran, there's a number of you. I've seen you come in today. I haven't seen you for a long time. Having a business team around you that actually supports you to do the work that you want to do, and who I felt were amongst the most important people in the Institute. And I really would not have gone to NDRI if somebody like Fran hadn't been there, who I'd known for a long time, and I knew how good she was at her job. She didn't always feel that she was, but she was. She worked far too hard, and I'm the same now. And then the other thing is being collaborative. Research is such a competitive area that we forget to work with each other. And it's part of how the system works. The way people are rewarded is for whether or not you were the CIA, rather than whether you actually made a difference in the community, that your impact matters. So, and the other, Michael mentioned, when I got the job, I'd sat on many government committees, national committees, IGCD, which you were on, Neil, and you'd hear people say, "What is NDRI? What does it do?" And I'd hear them say the same about NDARC and so on. And that was one of the things I thought, wow, I'm going to have to make sure I have a physical presence elsewhere. And so I travelled a lot, much to the disgust of my family. And then when I stopped travelling, I said, "Why are you home so much?" But I went to everything around the country. I decided that I was going to respond to the media, which is difficult when there's 3 hours time difference. So I made sure that I was on the media. I made sure that I was available to ministers. I made sure that, going to things and being with people, sometimes donating my liver to the cause, sitting having another beer with.
He's going to say with me.
With Mike. So being willing to spend a lot of time and responding to. So when the Commonwealth would say, "Could you?" I'd say yes. Because these were the guys who decided whether or not we got any funding or not. And saying no is not a good idea. But the main thing is actually that I look back on is, and a lot of people said it. I got lots of emails when it was announced that how, and it really mattered to me because I actually wanted to do it. And that was to work with people and to collaborate with people and not to have the most first author and to support junior staff. I mean, I still see colleagues who have retired or senior having arguments about who should be the first author. Why? Are you going to apply for another fucking job? Support the people who are coming up. They matter more than your career now. So, and if that's what I left behind, really, I'm really proud of that.
Well, just to say that when I came here first, one person who helped me immensely was Steve. He was very supportive of me figuring out, particularly things I didn't understand at all. Mind you, some of them I still don't understand. But so that is about, and I agree with Steve about collaboration. In terms of everything, I don't know how organizations work. I've worked on the principle of find good people and don't get in their way. And I think that's the thing I try to adhere to most. Don't get in, give people, if they're good, give them everything you can find to enable them to do their independent work. And don't worry if it doesn't all fit together.
Excellent.
Pretended strategy.
And
That's-
and
yeah,
there's a lot of those good people in this room.
there are.
Susan, Will,
Don't start naming
no,
names.
no,
now.
no,
You'll be in
no,
trouble.
Naomi, you know, and I look
Yes.
around the room and I see all these people that I've worked with, and
Mm.
it's
Yes.
fantastic.
So as you move into the next phase, I would like to use the word retirement. What are you most looking forward to doing or continuing to do? And the other half of that question is, what are you most looking forward to not doing?
Not worrying about where the budget's coming from.
Yeah.
That's brilliant. I'm most looking forward to playing the very expensive record deck that I bought myself on the day I retired, which I've played one side of a record on, and I'm still busy as so. I'm looking forward to still being connected, still trying to make a difference. I've agreed to mentor a couple of people, early career researchers, and I take great pride in being asked to do that, and I take great pleasure in doing it. I mentor quite a few young men in football, in professional football, and I really enjoy doing that, especially some who come from the country areas and just want the old guy who they can talk to, who can intercede on their behalf. I take great pleasure in that. I love footy, even though I support the Fremantle Dockers, and spending more time with my new partner.
So there's a story about the professor who goes to a conference, and somebody asks him, "Professor, who's doing your work when you're away at the conference?" And he says, "The same people who are doing it when I'm there." And I think being involved with things will remain. And the thing I'm hoping I will do too is I spend a bit more time in Europe with my 2 children who are living in Amsterdam.